Single gene diseases are a group of genetic disorders caused by mutations in a single gene. These diseases can be very serious, often leading to life-threatening complications or early death. For families affected by or carriers of single gene diseases, the prospect of having a child with the same condition can be devastating. In vitro fertilization and preimplantation genetic diagnosis are two medical technologies that can help families affected by or carriers of single gene diseases to have healthy children. IVF involves fertilizing an egg outside the body, and PGD allows screening embryos for genetic defects before they are implanted in the uterus. IVF and PGD have the potential to transform the lives of families affected by or carriers of single gene diseases. By giving families the option to have a healthy child, these technologies can provide a sense of hope and relief. They can also help to break the cycle of genetic disease, creating healthier, happier communities. The emotional toll of single gene diseases can be overwhelming for families. When a couple learns that they are at risk of passing on a genetic disease to their children, it can be a very difficult and painful experience. They may feel a sense of guilt, shame, and fear. They may also worry about the impact that the disease will have on their child's life. For families who already have a child with a single gene disease, the challenges can be even greater. They may have to deal with the physical and emotional needs of their child, as well as the financial burden of care. They may also feel isolated and alone, as they may be the only people they know who are dealing with the same situation. For families affected by or carriers of single gene diseases, IVF and PGD can offer a sense of hope and possibility. By allowing families to choose embryos that are not affected by the disease, these technologies can help to ensure that their children will be healthy. The stories of families who have benefited from IVF and PGD are often inspiring. For example, a couple at risk of passing on cystic fibrosis to their children could use IVF and PGD to have a healthy daughter. Another couple, already having a child with spinal muscular atrophy, could use these techniques to have a second child unaffected by the disease. In addition to the personal benefits they offer to families, IVF and PGD can also have a positive impact on society as a whole. By helping to break the cycle of genetic disease, these technologies can help to create a healthier, happier communities. IVF and PGD are powerful technologies that have the potential to transform the lives of families affected by or carriers of single gene diseases. By providing families with the option to have a healthy child, these technologies can offer a sense of hope and relief. They can also help to break the cycle of genetic disease, creating healthier, happier communities.